Tendencies with the hip. The hip car is complicated because you have to look from so many different angles. We're really moving in all planes of motion. So I want to see angles from multiple sides. And when you're doing it on your own, make sure you film yourself from maybe a side angle or right in the front and then off to the side as well. So we'll show you two angles here and we'll talk about some of those compensations. All right, Kyle, so go ahead and begin your car. You can take some tension and then flex your hips so your foot comes up enough to externally rotate. So with this external rotation, or even when you lift your foot up, you might see a hip drop almost right away. You might see your pelvis tilt a little bit, and then when you start to rotate, you might see the knee come out a lot. So in order to get that rotation, there's some sort of compensation happening. And then go ahead and abduct out to the side. Now here's when we're gonna see a lot of pelvis stuff. You might see some lateral flexion here. You might see some early rotation. We really wanna do one motion at a time. So now that he has complete abduction, he's gonna rotate internally, and then this is where a lot of people will dip their shoulder or all sorts of different things because they don't have internal rotation, and then back toward the opposite knee. Good, reverse, coming up, and now he might dip to the side, and as he externally rotates, good, that's pretty good. Now back to adduction, external rotation, that hip drops again because there's something going on there with external rotation. He doesn't have it, the pelvis is responding. Now let's go ahead and turn to the camera, side to the camera, and I'll get down here. Okay, let's go through this again. Now we're gonna look for some different things. So now I'm gonna look to see how much flexion he has from the side angle. Okay, good. Now go ahead and make your way out to the side and then internally rotate. Now I'm watching from the side now to see what happens with his spine. And also as he comes down, I'm trying to see what happens if he has full extension or if that's coming from the low back. As you can see, it's coming from the low back a little bit. Go ahead and reverse that. Good, he's doing a pretty good job. There's a little bit of tilting, there's a little bit of pelvis dropping. Just film it, note what you see, and then we'll work toward correcting that. And so what did you feel there?
Just restriction. So I would probably say definitely like TFL, kind of front of the outside of the hip area.
Cramping or?
Tightness, yeah, definitely when I come into the side here.
Okay.
Side pose. The rotation and stuff actually feels okay. It's just when I come all the way out, that's when I can't do it.
Okay, so cramping is okay, but what we have to be careful of is that closing angle, is that a closing angle joint problem? We'll have to use some of our more detailed assessments to figure that out. But it is a really good finding, it's a good place for us to start. So we know when we do some of the more detailed assessments that we're gonna have to dive into that a little bit and see what's going on there. It might be as simple as doing some of the soft tissue work, but we might really have to focus on doing some long duration stretching too.
And that's what I would say is that, like, even if you don't know right or wrong, we know what we feel might be an issue. And if we target it in certain, with soft tissue, with foam rolling, or with longer stretching, and then we check again, did it change? And if it changed, even if I don't really understand, I know that what I did helped.
Yep.
Right, so you can kind of differentiate in that regard as well, that like, is what I'm doing helping, yes or no? And you can go back to this and say, oh, feels freer, good. And so now if I know I'm gonna go do an activity that requires that, then do that first so you have the space to work with.
And this is a good time to remind that movement is the fix. The soft tissue interventions are not the fix. Those interventions, the soft tissue, when you're rolling on a ball or you're rolling on a foam roll, it might help you to calm the tissues down so that you can move better. But moving better is what's going to tell your nervous system that you have that now and allow for your system to remember it so you have access to it when you're doing what you love.